Patients of Malin Medical and citizens of the United States, hello, and welcome to Malin Medical Magniloquence, Episode 2, Stop COVID-19 Panic. My name is Kerry Malin, and I am the owner of Malin Medical in Spring Valley, Arizona. Never in my more than 20 years as a primary care provider have I ever seen such panic and overreaction to an upper respiratory virus. Now, I don't want to seem insensitive or underplay COVID-19. It's a bad upper respiratory virus. You get a bad cold when you get it. And most of us will do just fine and have a bad cold from it. Some of us who may be sick, have lung disease, heart disease, elderly, or immunocompromised systems, if they get any upper respiratory virus, they could potentially die from it. We have been through by far worse influenza epidemics, pandemics. In fact, a little more than 10 years ago, H1N1 influenza hit this country and by some reports killed an estimated of 600,000 Americans and 12 million worldwide. But we didn't react this way and we didn't panic like we are now. So I have to ask myself, what's different? I can't make sense of why we have gone to the level of basically shutting our country down for bad cold. Blows my mind. So what do we know in America today? Well, we know that governments across the world use the media as a tool for propaganda. They use it to achieve political objectives. And they also use the media occasionally to instill fear in the population as a means of control. Now, our communistic countries and socialist countries do that very well, and they achieve very effective control in those countries. But I don't think we want to be like that. Now, we also know the media only survives if they hype stuff and glorify things so that you stay tuned into them. Now, I think this is a pretty bad combination. Now, throw on top of that the fact that right now we have a pretty dysfunctional government, from what I've seen, more dysfunctional than any time in history. We have Republicans against the Democrats, and it's a battle. And I feel like we're being caught in the wake of this battle, and the result is this crisis. Our Republicans and Democrats need to learn to work together for the people. We elected them to do a job for the people, not for their own political objectives, not for their political party. It's for the people. Now, I'm a patriotic son of a gun. I was born on the 3rd of July. I was an ex-combat medic in the U.S. Army, and I fought in Desert Storm for this country. I do not like what I see happening to our citizens and how our government is handling this at this time. The effect of shutting our country down is going to have devastating consequences, and it will be for a year or more. The analogy I came up with is that our government has basically put a tourniquet around the arm of America for a paper cut in our finger. Now, did we really need to put that tourniquet around the arm? I don't think so. I don't think we would have bled to death from that paper cut in our finger. And now we're all going to have to suffer the consequences of that tourniquet being put on our arm. And we might even lose our limb. So I would encourage all the people in America to contact your local mayors, governors, senators, congressmen, government officials, and say, enough's enough. Let's open this country up and get back to work. Now, we can act responsibly as citizens, and I don't think we need to be treated like children and put in timeout and quarantine by our government. We've all been through cold and flu seasons before. We know what to do. We know that if you get sick, stay home, drink fluids, vitamin C, chicken soup, all the things grandma used to say. We know how to do this. We've done it before. we're just kind of acting a little like we don't know how to handle this. In case you forgot about, cold and flu and how to handle things, President Trump actually sent out this little guideline for coronavirus and things you can do to help prevent the spread of viruses in general, hygiene issues and everything. If you're sick, don't go to work. Don't go to school. Don't send your kids to school sick. Stay at home. Don't spread the virus. Rest. Drink fluids. We all know this, but at times we don't do this, and I can say I'm guilty of it myself. I've actually gone to work sick before and wore a mask and saw patients, but we all know what to do here. It's common sense, just like when there's extreme fire danger in the national forest. Well, we don't shut the whole forest down. We can't do that. But we do put up signs that say extreme fire danger. Take precautions. No open campfires. Don't flick your cigarette butts. Common sense stuff that we know what to do to help prevent forest fires. So why can't we be the same way when there's a bad cold and flu or coronavirus outbreak? Well, extreme viral load precautions. If you're sick and elderly or immunocompromised, use a mask and gloves, use extra precautions, and all the other things that we know what we're supposed to do during cold and flu seasons to prevent the spread of the virus and to get over it ourselves. So let me tell you a little bit about what I've learned over my many years in the medical care profession. Coronavirus is a nasty cold virus. It's been around for years. I studied about it in medical school more than 22 years ago. It got its name because of the little corona that's around the viral particle. Has nothing to do with Corona beer. It's perfectly safe to go out and get a Corona if you want one, so go ahead. All viruses follow up the same kind of path when we get it. All the upper respiratory viruses, human rhinovirus, human adenovirus, respiratory syncytial virus, influenza. When we get sick from it, we get worse, 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 peaks about day 4 or 5, and then we start getting better over the next 7 to 10 days. Now, if you have underlying conditions like allergies, if you smoke, if you have lung disease, the inflammation in your lungs can persist for several weeks, and you can have a productive cough for several weeks after. But usually it should follow that viral curve of 4 to 5 day peaking and then getting better. Now, with any virus, you can get worse from it. A secondary infection can set in, pneumonia, bacterial bronchitis, sinus infection, ear infection in kids. So if you see it's not following that typical path of a normal viral infection, then absolutely you need to seek medical care. But I'm encouraging patients not to go in if they have a little bit of a sore throat, runny nose, and a little cough. If you have a fever greater than 103, shortness of breath, and you're getting sicker, you need to go to the hospital or seek medical attention of some type. So during this COVID-19 crisis, we should play it the same way we know we always should. Don't panic is the message. Like I said before, coronavirus has been around for a very long time. Back in 2003, it mutated and became SARS. I don't know if you remember that. All viruses can mutate. In fact, influenza virus mutates so quickly that we have to update vaccinations every year because of how rapidly they mutate. The coronavirus also mutated back in 2010, and they called it MERS. So occasionally viruses mutate. They get a little more virulent and cause maybe a little worsening disease. But this virus still has a much lower mortality rate than influenza. I mean, we're looking at worldwide totals less than 100,000. So we know it's not that virulent or that doesn't cause that much mortality. I think the reason that the CDC was concerned is because Well, we don't have a cure. There's no cure for the common cold, people, believe it or not, still in medicine. And we don't have a vaccine for it because we've really never needed it. So, because we don't have a cure and we don't have a vaccine, my question would be then why do we keep testing for it? Because that's wasting millions of dollars. Now, yes, it's nice to test and track it, and that's what the CDC is doing. But if people are sick, and I can tell you that millions of people got sick with this, and some of them got a bad cold from it, and they didn't go into their doctor, they didn't report anything. So there's millions of cases of this that have gone around and that weren't tested, or and because of that, our mortality rates that they're quoting are much higher than what they actually are. My final message is to our governing officials. President Trump, you're the chief, baby. You can stop this right now. You can sign an executive order and say, stop all the restrictions and quarantines and get this country back to work. There are a lot of people that are suffering because they've been out of work. People who are living paycheck to paycheck and can't afford to be out of work. Small business owners, restaurant owners, they can't afford to be shut down for 2 to 3 months. We have to get America back to work. People of America, thank you for your time. I hope you stay healthy and financially sound during this crisis.